Hello, everybody. How are you tonight? Happy New Year. I'm Dr. Ritamarie Loscalzo, for those of you who don't know me, and I am very excited to be here to just share some stuff and to get our new year kicked off right. If you're a holistic health practitioner of any kind, a nutritionist, a doctor, a nurse, chiropractor, physical therapist, herbalist, you name it, then I want to share with you just some of my thoughts in moving into the new year. As I wrote in an email I sent out today, I got upset yesterday. I get upset fairly often about this particular topic. And when I say upset, I mean it didn't ruin my day or anything, but just I get outraged and I get more and more passionate about what I do, what we do, what you do in the world. Because if you're dedicated, like I am, to helping people to truly be well, to helping people to overcome whatever ailments, whatever fatigue, whatever issues are going on for them, then it gets frustrating when you hear the stories. I hear the stories over and over. This time the story was from my own family member, and it just outraged me that they just take whatever the doctors tell them as gospel and do it without asking questions about side effects, without asking questions about, is it really going to solve the root of the problem? And the situation that happened yesterday is my husband said that his brother, he called him and said, hey, I've got this problem and I don't want to talk about it here. But anyway, they went to the drug solution without asking, is there an alternative? Without asking side effects. And there are so many alternatives, especially for what was mentioned. So I got to the point of saying we need to educate more people. You and I, as health coaches, as nutritionists, as doctors, as nurses, we need to educate more people about the fact that they have alternatives. So just before we get too far in, I want to make sure everybody can hear me okay. So post on Facebook, post a message. I don't even see where oh, there I am. I'm looking to see about the people. There we go. We have a few people who've joined. And as you come in, let me, just a second. As you come in, let me know where you're from. I'm freezing, by the way. This is the first day I've gotten dressed out of my workout clothes and big old puffy jacket because it's been so cold here. So wherever you are in the country, hopefully you're in nice, warm Florida or the Bahamas or something. You're keeping warm. But it's a new year, and we've got to get our message out there bigger than ever. You know what I mean? Bigger than ever. I know some of you are medical doctors. I saw Allison just joined. Hi, Allison. Allison's a medical doctor from the UK, and she's seen the horrific things that happen. And we've discussed the horrific things that happen when people are just prescribed a pill without any understanding and without any approach to getting to the root cause. When you just prescribe a pill, and I mean a pill being the medicine, but also we can tend to get into that mode in functional medicine, which is supposed to be getting to the root cause. But a lot of docs move from allopathic medicine into functional medicine. And what they do is they just learn new tools. They are still doing the this for that approach. Have you seen that? Post if you've seen that. Oh, you've got hypertension. Here's an herb that helps with hypertension. Oh, you've got chronic sinusitis. Here's some herbs that help with that. What we need to do is we need to step back, understand what's going on in the body, understand how the body systems work so that we can figure out why. Why did this get out of balance? Was it something in the diet? Is it a nutritional deficiency? Is it some problem in the gut that's not allowing the nutrients to be absorbed? Are there some genetic components? And by the way, people blame their genetics, and that's what this family member was told, that it's a genetic thing. And genetics are 5%. Environment and lifestyle are 95%, the epigenetic modification of genes. So yes, somebody who has a gene for heart disease, for neurotransmitter imbalances, for anxiety, they're going to have more of a tendency to get that when the environment isn't right, when the body abuse is there. So for example, in my family, heart disease is big. Diabetes and insulin resistance. I have tons of genes related to that. I have to be super careful about the abuse I do to my body. I came up with a quote the other day that said basically that when the genetics and knowledge of the genetics knows how much, gives you how much leeway you can be to be careless. And if you have great genetics, then maybe you'll live to be 95 like George Burns, smoking cigarettes and drinking alcohol and eating poorly. But if you're not, if you don't have those pristine genes, and I rarely see them, then you've got to be more careful. And I believe it's like playing Russian roulette when you just start, drinking, eating sugar and abusing your body without knowing that, but also like without thinking in terms of what's really important. And I know a lot of you as health practitioners have come there because of being sick yourself. And you may be still on the path to making these changes. I highly recommend that you develop the skills to understand the root causes, not just study, take an herbal course, which gives you a list of the herbs and what the indications are, but to really get to know how this thing works, this thing we call the body. It's amazing. And when you understand how it works and you get back a lab and you look at the lab and you go, whoa, why would the iron be high and the ferritin low? Isn't ferritin a stored form of iron? Shouldn't the excess iron be stored as ferritin? Oh, why is this number high and this number low? And there's a lot of examples of that. And when you understand how the body works and you understand what the lab markers mean, you can come up with those like novel solutions to things, right? It's not just about, oh, when the iron is low, we give them an iron supplement, right? When the B12 is low, we give them a B12 supplement. It's way more than that. It's why is the iron low? Let's correct the underlying cause. If the underlying cause is an imbalance in their gut function, low stomach acid, poor digestion, then we got to fix the gut. Yeah, we'll give them the iron supplement, but let's fix the root cause. And the way you're going to most likely get to that root cause is when you truly understand it. So what I see in the future, what I crave for the future, what keeps me passionate about doing what I do is the vision of a world where all practitioners know how to get to the root cause. Wouldn't that be nice? Wouldn't that be great if somebody took their kid in for ADD and the doctor said to them, well, how much TV do they watch? What are they eating? What are they drinking? Oh, this kid may not have enough B vitamins and fatty acids. And doesn't just prescribe B vitamins and fatty acids. Sure, that's going to be part of the protocol. But sets it up so mom learns how to feed her kid, how to nurture her kid. Maybe they have a health coach or a nutritionist in their office that they refer to because a lot of doctors don't want to get into all that detail. That's fine. But for you to be the best practitioner and the best detective you can be, you need to understand how it works and you can come up with these great ideas. So my vision is that the world looks like that. And what would that change about the external manifestations of the world? What would that change? Think about that. What would change in the world if every practitioner knew the stuff that I know and that my colleagues know and that many of you know about rebalancing the body, about balancing the diet, the lifestyle, all the sleep factors, the stress factors? If everybody knew about that and was taught by their doctors, we'd have less heart attacks, we'd have less strokes, we'd have less cancer, we'd have less of all the major disease, autoimmune disease. And guess what? What would that do? That would make people happier. Wouldn't it be people be happier if their mom and kid didn't just suddenly drop dead of heart attacks or their kid had to go through chemo for cancer? It's devastating. So I believe that every choice makes a difference. Every single choice that you make, that your clients make, makes a huge difference. It makes a difference in how they see the world. It makes a difference in their health. And it makes a difference in how they can live their life. So your job as a health coach is to understand how this body works so you can better educate them, empower them to be able to live the life of their dreams, to be able to step into life and be the person they're meant to be and reach all their goals. We have the power to help them with that. We just have to learn how to get out there. We learn how to get out there and understand what's going on. So I wanted to share with you. First, I want to check to see if there's any questions or comments because I want to keep this interactive. I wanted to share with you a few slides I put together from a presentation I did weeks ago. It's just a subset of it, but just to hone in on a couple of the points. Let's see who's here. It looks like Mallory. Great. Mallory asked a great question, and I'm going to share with that in a bit. How does a mental health worker find education about understanding lab work more fully? Great. I will give you some solutions in a bit. Looks like Joe, Casper, Lynn, Rose, Misty, Allison. Allison's is an MD in the UK. She said, fortunately, more people are beginning to be aware and are open to my suggestions to avoid antibiotics or probiotics or take probiotics. She actually got her hand slapped in the NHS, the National Health System, because she was recommending probiotics. They said that was outside of the scope of what they did. What? It's outside of the scope to get people healthy, to restore their gut microbiome? This is what we're up against, and this is what we have the ability to change. It's changed so much since I've been in practice. Who else joined? Keldy. She's freezing too. Hey. Joan Evans. Yay. Joan Evans Reed from Raleigh. Cold there too. It's cold all over, except I think maybe the tips of Florida. Let's see. Judy. Great. Cold there too. Everybody's cold. Yes. Hear me loud and clear. Great. So this is what Allison says as an MD. She says, you wouldn't believe the number of packs of ibuprofen my husband bought wholesale. He always takes medication when he gets colds, aches, and pains. Oh, and this is what we're up against, is people have been trained. They've been trained by the medical system that you take a pill for every ail, right? If you watch TV, you see commercials like that all the time. I try not to watch TV, but you take a pill for every ail. And a lot of people go from that mentality into the functional realm. And I see this a lot in our practitioner community. We have a Facebook community. We have a couple hundred people in there. And I see sometimes people posting, I just have a new client with hot flashes. What do I do? And really, we've got to start with the foundations. Yeah, there's herbs that can help with hot flashes, but they don't necessarily get to the root cause of hot flashes. Did you know that hot flashes are most likely caused by a gut dysfunction? That gut dysfunction can create an imbalance in the estrogen ratios and the excretion of the poor estrogens, the bad estrogens, quote unquote. Did you know that? And most people don't. Most people start with the symptom, whether they're in functional medicine or they're in the regular allopathic medicine. And my approach is to treat everybody as an individual and get to the root cause. Personalized healthcare is the healthcare of the future. But you got to have the tools to be able to do it. It takes more time. So in the NHS, where Allison got 9 minutes per patient, there's not a lot of time to get to the root cause, let alone to prescribe a personalized program, which is why she left and is doing her own thing and doing a lot of work with bioidentical hormones, but with hormone balance and educating people that it's not just about taking up bioidentical hormones. It's about finding out why, getting to the root cause, looking at the adrenals, looking at the stress factors, looking at sleep, looking at the thyroid function, looking at gut function, blood sugar balance. You know about blood sugar balance? So many people just don't even know they have blood sugar imbalance until it becomes too late and they get diagnosed with diabetes. And did you know that all the bad side effects of diabetes, like peripheral neuropathy and problems with the eyes, the retinopathies, those don't start the day you get diagnosed. Those have been building up for decades. And the point is that you as a practitioner can help people to overcome that. You as a practitioner can help detect that decades earlier. while it's still brewing, when most people don't realize they have blood sugar imbalance, but they're tired and they're brain foggy and they have aches and pains, they don't associate it with blood sugar. So these are all the things that it's important to understand in order to truly help someone get well. So who else is here? And then I want to show you some stuff. And Allison, more people are becoming aware because why? Because of the internet, because of the education, because of Facebook. Let's just face it, the education that's available. But the problem is there's a lot of bad information out there. There's a lot of generalized information. And I've seen patients, clients come in and they have tried this. They went to this site and that site and another site and this summit, and they learned all these things. And some of those things were conflicting. And they tried to do it all. What I believe is we need to give people an opportunity to have personalized healthcare. And you and I can do it. We can change. Whoa, I just leaned on my desk and fell down. We can change the course of healthcare. So who else? Cindy Johnson, do you think it'll be a long time before regular medical people will finally learn the truth? It's so frustrating to listen to my brother, an internist, tell our family that food doesn't matter much. If your brother's saying that, and other medical practitioners are saying that, they're blind. They're blind to their own research. There's tons of research. Just go to Medline and search it. And you might want to look and see if you can find an article to share with your brother. Articles, right? About something that he may not think is food related. Don't choose digestion or blood sugar because he may kind of get that those are food related, but choose something else like hormone imbalance in females, like eczema. There's a lot of articles out there on the gluten sensitivity and how it can cause schizophrenia. It's all in the medical research. So it's a matter of opening up people's eyes. And how long do I think it'll take? I think it's happening already. I've been in practice for 25 years. I got into this because of my own health challenges and not finding solutions in medicine. And then just said, well, I wonder if it's my diet. My diet's pretty crappy. Let me see if that has anything to do with it. And I started researching and discovered that it indeed did. And when I changed my diet, changed my habits, I changed my life. I was miserable back then. I was so brain foggy that I was like this while I was talking to people trying to focus on what they were saying, right? I had sinus stuff and I doubled over in pain when I ate. All that's gone. 30 years, no medications, no interventions. I haven't had a doctor visit in probably over 15 years, except for when I broke my arm, but I don't go to doctors. I just feel great all the time because I've taken control. And I want you to learn how to teach others to take that control. I call it empowered healthcare, self-empowered healthcare, right? We want them to be self-empowered. We want to give them the tools. And I believe that we need to educate people about how the different body systems work before you just give them a protocol, because what happens is if they understand it, they're more likely to follow through. I remember one patient, I'd worked with her for about 6 months. She started out in 190. She ended up at 123. And she said to me, you ruined Cheetos for me, with a big smile, right? She said, before I knew Cheetos were bad for me, everybody knows Cheetos are bad for you, but I would just mindlessly eat them while I was with my friends. I tried to be healthy at home, but I ate these Cheetos. And she said, once you described that whole thing about fats and oxidized fats and how those things were affecting my body, she says, I didn't want to see them or touch them anymore. So imagine if you had the tools to be able to teach people how their body's working at a lay person's level. If you had those tools and you could empower these folks, how would that feel? Like if all your clients walked away knowing this stuff. They're my favorite clients, the ones that know. I don't know if Paula's on, but Paula is one of them. She just studies and researches and she wants to make the best decisions. And I just talked to her this afternoon and, explained stuff to her. And she wants to know more. I give her papers. She reads them. She reads the lab interpretation. Empower them. Because their health is their responsibility, not their doctor's responsibility. And if they leave it in the hands of the doctor, they're going to have the average course of health. which is get miserable, get miserable, get miserable, get miserable, be on all kinds of drugs, and then die. No, not for me, right? Not for the people that you care for. So you need to have the tools to be able to do that for people. So I'm going to share with you in a couple of minutes what I feel like we need to succeed. Each of us needs to succeed as a health practitioner to be able to make a living doing it, because I know a lot of you do this part-time while you have your day jobs. How can you make a living doing it? How can you really support people? How can you learn how to read their labs? Because the doctors don't know how to read their labs. They've been trained. They've not been trained to read their labs. They have been trained to scan the lab for H or L, high or low, and say, oh, this is a little high, but it's no big deal. Oh, this is very high. Here's your medication. That's it. That's what I've seen. As a functional practitioner, functional nutritionist, functional health coach, functional doctor, you can learn to read those things and get amazing information about people, right? And help them to get a handle on some imbalances before they become disease. It's harder to reverse a disease than to correct an imbalance, isn't it? I want that for you. Okay, I don't see any others. Okay. So let's just talk about this. And Mallory, I'll talk to you about, we have in our nutritional endocrinology practitioner training, we have a module, 2 modules actually on lab testing per se, and then a lot more intertwined. We have a module on basic blood chemistry, the chemistry that most of the doctors run. So you can become really familiar with the ones that the people are going to walk in and have with you. And you learn how to read that. You learn how to interpret the nutritional signs. You learn how to see when there's warning signs. You learn how to read trends. You get a spreadsheet that you can have people put their numbers in, and then you can watch trending. They may have normal liver enzymes, 10. Maybe the next year they have normal liver enzymes. Oh, 15. Maybe the next year it's 20. It's still normal. You're looking and going, honey, you got a problem here. Your liver is getting stressed more and more. Now, if it goes up, it's here, and then it goes down, and it goes back up again, that's different. They may have had a temporary dip, a temporary stress. But if you're watching trending numbers and they're going down, there's stuff you can do about it. You need to support them with liver function. All right. So, and then we have an advanced blood chemistry module, which is going to go to all the extra stuff, ceruloplasmin and the lipid fractionation and all that kind of stuff. And then we have within each module, we have assessment pieces. So how do you do Dutch tests, which is for hormones? How do you do stool analysis, which is for the gut? How do you do adrenal hormone testing, advanced thyroid testing, and all that? So let me just share with you. I'm going to just share my screen a bit. So you'll see me in the corner and my screen. Let me just figure out how to do this. Okay, it's right here. And I'm going to say share screen. And you should see my screen in a minute. So I mentioned to you a bit ago, like, what do you need to succeed? So we all need this to succeed. And I believe there's 3 things. One is you need to have self-nurturing. And here's what happens. Docs, somebody goes to medical school. Great, go to medical school. And what happens in medical school? They beat the hell out of you. Sorry for my language. They just work people too long of hours. They have to go like 17, 18-hour shifts, sometimes 24-hour shifts. They're stressed to the max. They're drinking coffee like crazy and eating junk food because they don't have time to prepare meals. That's not self-nurturing. And you can't be a very good practitioner if you're like exhausted and beat out, and you can't do that. You can't stay on the leading edge. So self-nurturing. You also need really good clinical skills, clinical mastery, I call it. And that's where you know how to read labs, you understand how all the body systems work. And you can immediately, when somebody starts talking to you, really start to highlight where you think some of the imbalances are. And then you know how to test. And then finally, you need really good, authentic marketing and business strategies. What I see so often is people watch other people marketing and they go, oh, I'm going to do that. Oh, I'm going to do that. I'm going to join this practice management thing, or you have to do it from the heart. It has to be authentic to you. So I believe that people are imbalanced when some of the basic pillars are out of balance. So you have to have an understanding of what are those, what I call the pillars of health. We call them the body freedom foundations, because who doesn't want to be free from ailments in their body? Who doesn't want to have to not be a slave to their body? So I call it the body freedom foundations now. But they're the pillars. They're the pillars of health, and they're the core diet and lifestyle things that everybody needs. So certainly diet and nutrition, nutritional balance is there. Movement is there. You've got stress management. You've got the outlook, the attitude. You've got environment. You've got fun and sleep. I left sleep out. Isn't that funny? Because that's my challenge. And what if you had the tools to be able to, when somebody came in, assess which of those pillars is out of balance, or which of those multiples, but what's the priority to address that? Because when you can balance the pillars, they're going to be strong. They're going to be able to withstand everything. And then you can go to balancing their other systems. So you can see that these pillars are like the legs of a table. And when one gets knocked out, the table tips over, right? And what happens is the rest of the body, which relies on those pillars, sits on top of that table, is trying to be in balance, but it can't be. So the digestion goes out of whack, the blood sugar, the adrenals, the thyroid, all the sex hormones, and all the body systems, organs, and glands. So this is something that I like to address, and I share with people. So here's the pillars. Now the pillars are out of balance, are in balance here. But what happens if the digestion's out of balance? Well, nothing else can be in balance. Nothing else can be in balance, right? So we got to start with the digestion. The blood sugar and digestion, I go back and forth with which one you got to start with, but really both of them. You've got to get both the blood sugar and digestion. So if you don't feel really confident in your skills around helping people with their digestion, improving stomach acid, mindful eating, taking them through protocols to heal different systems, SIBO and leaky gut and parasites and all that, then you need some more education. That's it. You just need some more education. It's easy. I mean, it's not easy, but it's something that you just get the education to do. And we provide some of that. The blood sugar imbalances, I think, are just so hidden and occlusive that people don't get it. It's easy to tell when you have a digestive issue, right? Yeah, pain, discomfort, gas, bloating. Sometimes it's more hidden. Sometimes somebody has leaky gut, but they don't have symptoms, but it affects the rest of the body. They have brain fog and other things, and aches and pains and rashes because the toxins get to leak into the system. But blood sugar, unless you've been diagnosed with diabetes, unless you have a blood sugar meter like this one, and you're testing yourself at home on a regular basis, you don't have a clue what your blood sugar is doing. I'm just going to say that outright. No doctors test this except when a person becomes diabetic, and then it's kind of late. Everybody that has any kind of health symptoms should be testing their blood sugar, and these meters are inexpensive. And when you do that, you give people the opportunity to see how foods are affecting them, what foods raise their blood sugar, what foods keep them nice and steady. What's the impact of lack of sleep on blood sugar? What's the impact of exercise and stress? And so you have the ability to learn this stuff so that you can help people to prevent themselves from getting diabetes, to prevent themselves from getting heart disease. And if they already have it, to reverse it. And that's a pretty strong statement, but I've seen it over and over. When the blood sugar and the digestion are out of balance, the adrenals go out of balance. The adrenals are so important because they respond to stress. But they don't just respond to stress like, my kid flunked out of school, the bank account is down to -10. They respond to stresses physiologically in the body too. So if somebody has a gut infection or hidden imbalance in their microflora, their gut biome's out of balance and they don't have enough of their good bacteria and too much of the bad, the adrenals respond to that. Infections are big. Thyroid. Well, we all know about the thyroid. Years ago, nobody knew what a thyroid was, but the thyroid problems are so epidemic now that everybody knows what a thyroid is, right? Everybody knows. They talk about it. Oh, you're tired. Oh, maybe it's your thyroid. Go check it out. When people are tired, it generally is a hormone problem. When people are tired, it generally is a hormone problem. But it's not necessarily thyroid. And if it is thyroid, you've got to look at all the levels below, because the thyroid's very dependent on the adrenals. Very dependent. There's all kinds of mechanisms we don't have time to go into, like the way the receptors work and the way the conversion from T4 to T3 works, affected by stress. So the thyroid's very dependent there. The thyroid's dependent on the digestion, right? 25% of the T4 to T3 conversion occurs in the gut. So if somebody's got leaky gut and parasites and all this other stuff, how good is their thyroid function going to be? And are you going to solve the problem by giving them T4, which is what synthroid levothyroxine is? Are you going to solve the problem by giving them an herbal thyroid supplement without really looking at the root? No, you're not. Okay, so these are things that are so important for you to understand as a practitioner. And then sex hormones. Well, people come in with hot flashes, PMS, dysmenorrhea, all this sort of stuff. And they're given drugs or they're given herbs. But what's the root cause? Sex hormones just don't go out of balance. The ovaries don't just stop working randomly. There's got to be a cause. Liver dysfunction, huge. And I kind of lump liver with digestion. You'll see in my programs, I have a liver module in the digestion, because it's digestion and detox go hand in hand. Liver dysfunction. Why? Liver and gut dysfunction, because it has to do with the processing of the hormones. The hormones, estrogen is not just estrogen. Estrogen has three main types: estriol, estradiol, and estrone. And what most docs don't realize is estriol is a super protective one. Estrone and estriol. Estrone and estradiol are more potent in terms of proliferation. So it's a balance that nature provided. So we need the power of estrone and estradiol, but they have negative consequences. So, we've got estriol to protect. So this is part of it. But then once the hormones do their thing, they're used up, they go to the liver for phase 2 processing, usually through, I think it's the methylation pathway. Yeah, it's methylation pathway that takes those estrogens, breaks them down to excretory products so they can be excreted. But if the liver's not sluggish, it's not working properly, or you have some genetic tendencies, you may not be breaking down those hormones. And when you will be breaking them down, but when you break them down, you're not breaking them down into the safe metabolites. You're breaking them down into the dangerous metabolites. And these can all be measured on a Dutch test. And then the gut, if your flora is off, then there's further degeneration there, and you're not going to be able to excrete those estrogens properly, and they get reabsorbed. And when they get reabsorbed, then they circulate and they cause damage in the tissue. So you can see that, if you don't fix your gut and you don't get your liver working, then the sex hormones are going to be a mess. And there's also interactions between blood sugar and thyroid. We don't have time to go into all of that. Those are in-depth presentations that I have in my programs. And then what about the rest of the organs? Somebody has a problem with their heart, with their lungs, with breathing, with their skin, with their brain function. You got to go back to the gut. Got to go back to the gut. GABA, dopamine, serotonin, which are 3 important neurotransmitters, they get out of balance when the gut's out of balance. In fact, some of the good bacteria in the gut produce some of those. And actually, there's more serotonin in the gut than there is in the brain. Most people don't know that. So we've got to look at this as a sequential order matters. Order matters. We can't just say, this person presented with sex hormone imbalance. They have hot flashes. I'm going to give them some black cohosh, and I'm going to get them off caffeine, and I'm going to send them on their way. There's so much more to it than that. So much more. So in order for you to be successful, you need to be able to interview people. You need to be able to have really good interview skills. So in order to be able to interview somebody properly, or have questionnaires that they fill out, you need to understand how the body systems work. You need to be able to ask the right questions. And when they answer one question, that may spark another one, because your mind's thinking in terms of those biochemical pathways. You also need to be able to listen. I hear this so many times from people that their doctors don't listen. They tried to tell them and they go, oh, thank you for listening. Thank you for listening. I've been trying to tell people. I was wondering if that correlated to my current symptoms. And then you need to have an in-depth understanding of how the body works on the inside. Where is the duodenum? What is the duodenum? What does it do? What is the jejunum? So if somebody comes in and says their doctor put them on a feeding tube or their kid on a feeding tube because there was a problem, or a relative or whatever on a feeding tube, and it goes into the jejunum, that you're going, okay, what do we need to have to give the jejunum? We can't give blended up broccoli to the jejunum. The jejunum is the absorptive surface. You need to give digested already food. So if you're going to blend up the broccoli, you need to throw digestive enzymes in and let it sit and then put it into the tube. Most docs don't do that. And they wonder why people don't survive well when they're put on feeding tubes. They already have a disrupted digestive tract. I remember being in the hospital with my sister. Her husband was on his deathbed. He had had cancer, and then they removed a part of the lung, and then he got an infection, and he'd been in the hospital for about 4 months, and he was just going downhill. And they had put him on a jejunal tube, and I said, what are you putting in that tube? And they told me, I said, you need to put digested nutrients into that tube, because what's the jejunum? It's a digestive surface. If you start to put full foods in there, not these microscopics, it's going to aggravate and irritate the lining. The doctor turned to me and said, well, she said, the duodenum will secrete the enzymes and they'll go down to the jejunum. I said, really? Like, how's that going to happen? She didn't have an answer. I said, the whole process of stimulating digestive enzymes comes from the food exiting the stomach into the duodenum. It secretes some hormones and enzymes, and then it gets digested, and then it gets passed to the jejunum. So how's the duodenum going to get triggered to do that? And is it going to be in time because you're shoving in this broccoli, and then you're going to wait for this to go down? There's 22 feet of small intestine, by the way. I mean, they're not 22 feet apart necessarily, but they could be a good 12. Like, it didn't even make sense. Okay. So when you understand how all this works, you can ask the right questions. And then you, of course, need to have detective skills. You have to be a detective in this situation. You have to be able to look at labs, do a good history, look at the physical evaluations. And you know what? Even if you don't see people in person, and even if you're not licensed to touch people and do an exam, there are things you can have them do to give you information. Oh, look at the back of your arms. Feel that. Do you feel any of those kind of bumpy things? Oh, that's hyperfollicular keratosis. That's usually caused by deficiencies of vitamin A and E and essential fatty acids. Grab some water. And then you have to have love and understanding. This is what's missing in medicine big time, in addition to all this other stuff, but love and understanding. You're just a paper. You're just a number. This is what I love about Allison so much as a medical doctor. We call her she's in our nutritional endocrinology practitioner training. And we call her the hug doctor because she's just big into hugs. And she, in that 9 minutes that she has with those people, she gives them a hug at the beginning and a hug at the end. And not just a little quick hug, because she believes that, or she knows from studying, that you need about a 15 to 30 second hug in order to stimulate oxytocin, and oxytocin is very healing. So these are the little things that are so important and that make a difference. And I want you to have these skills. So I put together what I call the Unstoppable Practitioner Formula, which is self-nurturing, and that includes programs that I put together for my clients, right? They're all my how to balance those foundations, and then how do you have access to all those body balance programs, which is adrenal balancing and thyroid balancing and blood sugar balancing, digestive balancing, etc. And here's the thing, if you're not taking care of yourself, who will? And so we make sure that you do when you join our programs, our NEPT program anyway, because I believe that a good practitioner needs to be doing it themselves. So we give you access to every program that we have. You also need the clinical mastery skills. And I break it down into 5 parts. Connection. You need to be able to make a good connection with somebody. Get their trust and get comfortable, get them comfortable sharing their big why. Because when you can get them to share their big why do you want to lose weight? Oh, because I don't like the way it looks. And what if you lose weight? Lose the weight. What's going to happen differently? Well, I'm going to be fitting into clothes. I'm going to be able to go get new clothes. I'm going to be able to look sexy in my clothes. Oh, and why is that important to you? Oh, well, then my husband will pay more attention to me, or I'll attract a good mate. Oh, great. Why is that important to you? And you see, you just keep digging. You just keep helping them. Why is that important to you? Until you get to their big why. And when you get to their big why, and you connect that with the changes they're going to make, it makes all the difference in the world. The next step is discover. When you discover, what happens is you are actually digging into their history, their habits. You're asking them questions about these things. What do you eat? How much do you sleep? What's your dental history? What's your family history? And all that. And we have like 3 or 4 pages of questions that you can get into. And again, you don't have to ask them in person. You're going to mostly do it via questionnaire. But what if you can do this? What if you can really get at? Because if you don't ask the right questions, you might find that something that happened when they were 5 is creating the symptoms that they have today. You want to find that out and be the first one to find it out usually. Analysis, that's where you do your labs. That's where you really understand how to look at their standard labs that they got from the doc. And if you think other things would be helpful, know which kind of things you might suggest that they get. And then empower. You need to be able to give them the tools they need to do it. You don't just say, I want you to go on a gluten-free diet with no sugar and eat lots of vegetables. See ya, tell me how it goes. Right? Most of them won't do that. You've got to give them tools. It could be videos, recipes. It could be quick start guides, checklists. But you need to be able to give those people that. And empower. You need that's empower and balance. You need to be able to look at them, those organ systems, and help them to restore balance. So I'll talk to you in a little bit about how you can get access to support for all that. And then authentic business and marketing strategies. So you can be the best practitioner in the world. You can be ideally healthy. And then if you don't have the marketing strategies, it's not going to fly. Okay. I did a great job of marketing my practice by just being good. I got a lot of referrals, but it wasn't enough to have a sustaining practice. And once I learned the marketing skills and adapted them to me, I was able to help to grow a thriving business, helping people get well. So those authentic business and marketing strategies, you have to identify who do you want to work with. And I know we can all help everybody, right? Yeah, I can help everybody. But you can't do marketing to everybody, because when you market to everybody, you sell to no one. So what you really need to do is find this, what they call a niche. And I know it's hard because you want to help everybody. So what is something you can focus on? For me, I focused on fatigue. Now, the reason I chose fatigue is because most people that I saw have fatigue, but fatigue has a lot of underlying causes. So if I get them with that symptom, so if I say I work with fatigued 35 to 60-year-olds who are working hard and have a lot going on, and they can't afford to be fatigued, and they want to get their energy back, I can attract a lot of people because a lot of people have that situation. And then I can actually be able to delve into everything. But here's the thing, no matter what you choose, if you choose depression and anxiety, doesn't mean you're just going to work on the brain and neurotransmitters. It means that you still have to balance the focus of the foundations, and you're still going to have to look at their digestion and their adrenals and all those other things. Because remember, brain's at the top of the pyramid. Okay, so you just don't fight it, just do it. Pick something you really love to teach. Digestion. And you can always add another one, get really good at that, attract people, get the marketing going so you're getting a constant stream. And if you want to do more, then you can branch out and do another group. Then you need to package your process, because You know what? We all have a process. And if you don't yet, because you're just starting out, you will have a process. And most people fight it. They go, oh, well, I don't have a process. Everything's unique. And yeah, you're going to work on personalizing the programs to everybody. But you have a process. I sat down with somebody once and I said, well, it's different from, okay, what do you do first? So I'm Mary Sue and I've got this problem. Well, I'm going to do this and then I'm going to do this and then I'm going to do this. And I said, okay, so now I'm Fred and I have this problem. I'm going to do this. I'm going to do this. And most of the steps were the same. So you create a process. And when you offer a service to somebody, you don't just say, oh, yeah, you want to work with me? It's $75 an hour. And they pay you $75. And then you wait for them to come back. No, it doesn't work that way. You can do that for the first visit, but at the end of the first visit, you figure out if you're a good match, and then you make an offer to them for a package. Maybe it's a 4-session package. Maybe it's a 3-month package. Maybe it's a 6-week package. But you explain to them how you're going to take them through this process. You can show them your whole process and say in the 4-week program, we go through these steps. And that way you really get the idea. And we have a module that we have a whole thing in my nutritional endocrinology practitioner training called the Practice Building Success System. And we have a module. We have a module on each of these that I'm listing here. So it's self-education. And then you have the ability to come to calls, our open coaching calls, and ask questions and get help, not just with your client cases, not just with lab reading, but with your marketing. You package your process. Master strategy sessions. Oh my goodness, this is so important. If you're talking to people, you meet somebody at the grocery store, and a lot of people are taught to give free consultations and come check you out. But really what you want to do is strategy sessions. So it's really an enrollment conversation. You want to master that. So you meet somebody at the grocery store, they, ask about the kale, and you talk about making kale chips, and you talk about how kale is so important for XYZ. And they say, oh, I don't know any of this stuff. I've been having some health issues. You get in the thing, you find out that they have eczema, or they have arthritis, or they have Hashimoto's. And you go, I might be able to help you with that, with a nutrition diet plan to help support you with that. Why don't you schedule with me? We'll just schedule a free strategy session to see if it's something that I can help you with. And then you get their number, you put it in the calendar, you schedule it, and then you have a strategy session. But then there's a certain role to it. We have a module on that as well. Create your signature talk. This is great, whether you want to get out in the public and do talks on stages, which I highly recommend if you feel comfortable with that. Yeah, the library, the women's groups, the local celiac association, whatever's there. But you also want it to do online stuff and webinars. So it's really important to have that talk that you've crafted that really helps you to market your own services. And it's got to be from your heart. And then you need to get known and get booked. That could be going on Facebook, doing Facebook ads, doing Facebook Live like I'm doing now. It could be getting on summits, doing guest blogs for other people. And we share with you a lot of that in our NEPT program. This is a map of what we just talked about. These are all the little components of it. There's a lot to it, right? There's a lot to learn and there's a lot to do. So the self-nurturing is important to balance the systems. So there's I spelled out the pillars as the word freedom, because most people want that. They want to be free. They want to be free of body ailments and free of the limitations. So fun, rest, exercise, environment, diet, outlook, and mindfulness. And before you start teaching other people, work on yourself, or while you're teaching other people, you work on yourself too. And we give you the tools to be able to do that. Then there's the body balance system: digestion, blood sugar, adrenals, thyroid, sex hormones, brain, and then all the organs. And then there's clinical mastery, connect. I talked about that before. Discover. You go through the Body Freedom Foundation's assessments. In our program, we have tons of assessments that you can just take and use. You don't have to ask permission. We just give you the stuff that's done for you. Because you know what? It took me 15 years, 20 years to develop all this stuff. And it was slow going. And now I've got this process down and it's very successful. And I want to share that with you. It could take you 15 years if you want, or you can get the help here. Oops, there's something wrong with that slide. And those are the things. So you want to be able to assess these. We have this 7 pillars assessment form that you can come up with a score for each one. So you know right away where this person's out of balance in the pillars. And then you need to know how to take a nutritionally oriented history, and there's a 3-page document that has checklists, and you can create your own intake form that way, and also trigger to ask questions. After a while, it becomes natural. You need functional physical exam skills. This is where I learned physical exam from Bates, which is the guide that most medical schools use. But there's great stuff in there, don't get me wrong, but we want to apply that to function. Right? We're not just looking for disease. We're looking for dysfunction and imbalance so you can catch them before they get to disease. And then the other piece of clinical mastery is analyze. These are all the different tests that I think would be helpful. Now, some of you may not deal with certain areas of the body and you don't need to know them, but you need to know about them, even if you're not going to do them, because you want to be able to refer somebody to get testing if it seems indicated. So there's the blood chemistry, the home testing, the functional labs like the organic acids, adrenal, GI, stool, fatty acids, Dutch testing, NutriVal, hair mineral testing, food allergies, and genetics. We have modules on all of these things to teach you to master how to do this stuff. And then analysis skills to help you get to the root cause. Those analysis skills are the ability to take those tests and work with somebody. This afternoon, I did a consultation with somebody, and she had all her labs. And this is part of what we do in our year-long program. And she signed up for the highest level, where she got to have some conversations with me rather than just the coaches. And she had a lot of labs, and as we're piecing it together, I went through all these different labs. She had almost everyone on that list. There was one that she didn't. And what happened was, we found things to research. It helps you to become an even better detective and not just go by textbook. And the clinical mastery in terms of Empower, we have in our program, I provide my students with checklists and videos and online support and recipe collections. And part of the Empower is your coaching with them. How are you going to guide them through this to keep them accountable and trackable? Then we have all the customized checklists. You need these. Whether you work in our program or not, these are things you should be filling in the gaps with. So maybe you have a bunch of this stuff. Maybe you don't. Maybe you have some of it, but not others. So I'm giving you a framework to be able to be that practitioner that's going to change the world, that's going to inspire people to ask for better. So you've got recipe planning, meal planning, resources. I have tons of videos. I get in my kitchen once a month and I record and live stream me making food. And I try to make it real easy for people. I'm not one of those chefs that has everything measured out, because that's not real for people. So I just throw ingredients on the counter. I say, okay, what are we going to make? Throw them together. They get these recipes and they go, wow, that's easy. You want your client to have the tools so they can say, wow, this is easy, or easier than I thought. And then the final thing is the balancing the body systems. You need to know more about how does the digestion work? How do you get rid of parasites if they have them? How do you put them on a gut healing and calming protocol? How do you balance their blood sugar? How do you get their adrenals under control? And this isn't just like herbal protocols. This is diet, lifestyle, and herbal protocols for all of these things. The order matters, like I said before. The order matters. You've got to get their stress transformed. And you got to heal them in order: digestion, blood sugar, adrenals, thyroid. You got to get the liver working. And as part of digestion is where we work on it. There's the pyramid again, in good order. This is what happens when everybody's balanced. Everything's balanced. Yay! That's what you want for people. And then the marketing, we've got several areas. Identify your ideal client. Package your genius. You can do one-on-one programs, VIP days, small group coaching, large group, live events, workshops, retreats. So all of these are some questions on my big map that I have people answer. And then you want to learn about master strategy sessions. From a strategy session, you can sign them up for one-on-one, but you don't have to sign them up for one-on-one. You might have a high-ticket program. So, for example, we have a year-long program. It's called the Energy Recharge Coaching or Energy Recharge Inner Circle. And we're going to rename it to the Body Freedom Program, Body Freedom Solution. And people come in and they sign up for a full year. And in that year, we take them through all those foundations, all those body systems, do whatever labs are needed and help them to get better. And people get great results. You can offer a program like that. Really, anything that you're offering that's over $2,000, some cases over $1,000, you should offer through a strategy session where you get to know them, you ask them questions. So you have to master this. Creating a signature talk, you choose a topic, a format. How are you going to do it? And what are you going to offer? You can offer either a strategy session or a low price program because it's a talk. You haven't gotten to know them very well. So they're not going to sign up for a $5,000 program from a webinar, although I've had that happen 4 times over the last 8 years. Get known and get booked, whether it be on webinars, live events, podcasts, summits, social media, blogs, TV, and radio. But the important thing through all of this, guys, is you. Authentic, you coming through, people seeing you, your passion, your love. And that's what makes a difference. That's our formula. That's a map that I gave out this map at our Shine conference. So those of you who are at Shine, recognize it. You got to get to the real root cause of even the most challenging health issues. And that's why I created this program called NEPT, Nutritional Endocrinology Practitioner Program, which takes you through all those pieces that I just shared about. You get access to all of our client programs, the whole bundle. You get access to retreats, 36 modules, 2 live in-person events, which are amazing. You get a lot of done for you things, step-by-step action plans, a lot of conversation with me. We have basically weekly calls. Some months we might have a little less, some months we might have a little more. We also bring in, we also have some bonuses. Well, first of all, we have in the marketing side, we have marketing strategy modules. I call them molecules, But we have a library of guest presentations. We brought in great marketers who come from the heart to teach things. So whatever you're thinking about, you're stuck with, you can find something in our library. But you also get live trainings. We bring in people from, we try to do it every other month. Sometimes it's once a month. Sometimes it's twice a month. But we bring in people who have skills in the areas of enrollment conversations, in the areas of creating packages, in the area of public speaking, whatever. So those are really amazing. And then there's practical experience. And I forgot to mention on the clinical side, we bring in experts. It's not listed there, but we bring in experts. We have a library of experts, functional medicine people like Jeffrey Bland and Ben Lynch and Tom O'Brien and Anna Kabecka and on and on. So we have all those people that come in and talk to us. You get the opportunity to do it live with them so you can ask questions. And then we have a library depending on when you've come in the program. But we do that on an ongoing basis. But here's the thing that I think sets us apart from most other programs out there. You can get the education, but do you get the support? We give you internship opportunities. In fact, if you want to be certified, you have to do some practical application, just like in medical school. You don't just go to the education, you have to do your internship and residency. So we have internship opportunities where you get to coach people in my programs. We also have CEU and board certification through the American Association of Drugless Practitioners. Several of our programs are certified through the NANP, National Association of Nutrition Practitioners, and they're looking at doing the whole program. We're working on that right now. You also get paid opportunities on our team. That you have to prove yourself. You have to be got the education down and the skills down. But we have probably 6 or 8 coaches, right? Maybe 8, maybe more, at least 8 coaches right now who are on our team and getting paid to do consultations with people. So it gives you like an employment opportunity. So you may want to continue to do your own practice, but supplement your income, or maybe you just want to work for us. That's available. The other thing that's really cool is if you're not a licensed practitioner, like a doctor, a nurse practitioner, or osteopath, chiropractor who can get access to labs on your own, we have direct access services. So we have contracted with a number of the functional labs that normally do not provide or allow for health coaches, for example, to run labs. We've made an arrangement that we give them a list of the people who are allowed to do that, and you get it. Plus, you have access to this amazing blood chemistry software for analyzing it. So if you want to join us, it's by application only. It's not for everybody. It's only for people who are qualified to be in there. And you'll find out by setting up a strategy session with us. And it's at neptapply.com. Here's the thing. You may not be ready for it. You may not be right for it. And we're going to tell you. And if you're not ready for it, there are other programs that you might take to just prepare you. And we have access, and we have several of our own, but we also have access to others who have programs that might be more suited as a prereq to get in, okay? We're looking for people who are dedicated, people who are mission driven, are looking to change the world. We're looking for people who are just so highly motivated and so full of love. That's what we're looking for. So if you fit the bill and you want to change the state of healthcare and you're tired of those relatives that say to you, I just went on this medication or that, then, just try, just see if it's for you. You'll see an application. There's a full pay, I think it's an 18-page brochure on the page that you can download and see if it sounds good to you. And if it does, then join us. That's all I can say. What I want to do is give you a free gift, which is you can get this chart, this beautiful chart. I would recommend that you print it out in 11 by 14 if you have a printer that does legal, or take it to Kinko's or something like that and print it out on the big sheet. That's what we have. And I have mine right here. So you can see I have it nice and laminated, not laminated, but the shiny paper and all that. This is what you'll see when you get to the site, is this brochure. And it just tells you everything that, you need to know, and what you get in the program and who it's for. And like I said, we're looking to expand, but we're going to choose the people that are right for it. So if you feel like you want to explore that, go to neptapply.com. And team, whoever's on there, I saw Keldy on and Lynn, could you put this link into the chat there? Because I can't copy paste it from the slide. Oops. It's www.drritamarie.com/go/up formula. We call it the Unstoppable Practitioner formula. And that's for a reason. I believe, unstoppable is like, there's nothing going to get you down. You have everything you need to succeed. And I want you to be unstoppable. I have a book, I called it Unstoppable Health. So we thought the Unstoppable Practitioner was a nice companion for it. And it's called the UP formula. When I realized that it was the UP formula, up, we all want to be up. We want to be lifted up, and it'll help you lift you up, lift up your practice. So go ahead and put that in the chat, please. And that would be great. I don't know if I can. Oh, I can. Look at that. www.doctor/up formula. Yeah, and you can get right there. Okay, there's no need to sign up or opt in or anything like that. It looks like Lynn put up the NEPT apply. So yeah, I would highly recommend that you do that. I'm going to unshare my screen so I could be with you. And I'd love to answer your questions, whether it be about the program or whether it be about anything at all related to how you can become more successful in your practice. And I think there are some people who are on just the phone. And if you guys have any questions, there is a way for you to raise your hand, but it's not showing me your list. It's not showing me the list. So I guess there's no way for you to raise your hand. But you can type it. I don't know how you're going to do it if you're just on the phone. Sorry about that. Yeah, sorry. You can go to our Facebook page when you get back to the computer. You can go to our Facebook page. That's the INE, Institute of Nutritional Endocrinology. And you can type your questions. You'll see the video and you can type your questions there. So who else has something? Kelly posted it. Okay, great. Thanks, Lynn. And Lynn's one of our newer members. She's a homeopath and a nurse, and she's brilliant, and we love having her in the program. Allison, thank you. Allison's been in the program for a while. She's a medical doctor. And Allison says, I love the way you combine training in clinical skills and knowledge with the online business skills, Dr. Ritamarie. But the thing that was fundamental missing link for me was the vegan food information, as I'm a reluctant chef and was lost for words when people asked me further questions on food choices. Now I have knowledge, I can source it. Thank you. Terry Walls is another one. Nalini Chilkov, she's founder of the Integrative Oncology Institute. Terry Walls, Dr. Terry Walls is the author of the Walls Protocol for Reversing Multiple Sclerosis and Other Autoimmune Disease. The Holistic Hug Doctor. Yes, Allison, that's who you are. Thank you, Allison. She welcomed somebody, said, Ritamarie is my mentor. This gives you the true meaning of functional medicine. Homeostasis is key. You are so right. Oh, great. You're watching on the Sweet Spot Solution page. Yay. Wonderful. I think this got posted. I think we have this automatic thing that it gets posted to other groups and stuff. So I'm glad to see that. Those of you in the Sweet Spot Solution, which is our blood sugar balancing program, we're going to relaunch it in February. And it's amazing. And when you join the practitioner training, you get access to going through that yourself. And you also get access to the insulin resistance practitioner training part. So you learn how to take people through a balancing protocol for their blood sugar. Yes, Mallory agrees with me that knowledge is power. The better identify the balance to prevent disease. Absolutely. Okay, so Cindy, I hope you got your answer to that because, I mentioned about your brother. Get some research articles. I mean, I think it's happening slowly, a lot slower than I'd like. Let's see. Michaeline. Hi, Michaeline. Mallory. I think I got all the rest of them. All right. If there's any new questions, post them. Team, if I missed any of the questions, I finally figured out how to be on Facebook Live and answer questions, see the questions on Facebook. I just have it on a separate screen. I bought a little screen, an extra screen. Cindy, thank you. So Lorraine says, thank you for making this available. Oh, great. You know, I know there's some practitioners on the Sweet Spot Solution page. So if you are, and you're watching from Sweet Spot and you're not a practitioner, well, this is just some information that you can use in choosing your practitioners. And you can see why I do what I do and why I teach what I teach in the Sweet Spot. But if you are a practitioner, just text us about upgrading into the insulin resistance program, practitioner program, because it's an amazing companion. All right. Any other questions, comments? Team, anything else? No? Well, I've really enjoyed being here. You can tell I'm passionate about this. And things fire me up. Like when I see people being abused by the medical system. And I'm not saying the medical system's all bad. Don't get me wrong. When I broke my arm and I had a bone that was supposed to be the bone from here, jumped forward through the joint space and was here. I couldn't heal that naturally. I had to have it surgically repaired. Right? If I fall and crack my head and it's open and it's bleeding, I need medical care. And that's what medicine, Western medicine is so amazing at, is emergency urgent care. But they don't really have a clue as to how to manage chronic and get to the root cause. Why? Not because they're bad people, but because they weren't trained. They just didn't learn. And now so many of them are being open. We have several MDs in our program that are so open to making a change, to doing it differently. And the more and more, it's like a grassroots effort, the more and more people join us as part of the NEPT program, the more and more people are going to get well, because there's more practitioners, of course, but because it's that mass, it grows. So I appreciate you being here. I appreciate all you're doing in the world. If there's any way we can help you, reach out. Go to the NEPT Apply, set up a strategy session, find out if this program is right for you, or if a subset of this program is right for you. And we'll be happy to share and be totally honest and open and authentic with you, because that's what's so important to me. So thank you. Much love. Wishes for a happy new year, healthy, safe, prosperous, and beautiful time. Make it your best year ever. And if you're striving to just build that practice of your dreams, set up a time to talk to us and see if we can help you with it. I'd love to help you with it. All right. Much love. Bye-bye.